Good morning. My name is Maria and I'm here with MedEdge. And today we are at the second day of the 11th Abu Dhabi International Conference for Dermatology and Aesthetics. And we're going to start the second day with a very interesting interview because we have Dr. Benjamin with us. And Dr. Benjamin is going to tell us all about this technology that is applying to this amazing field of dermatology. Doctor, thank you.
Morning.
Welcome. How are you?
Perfect.
Yeah, bonjour.
You speak French.
Yeah, I'm trying, doctor. Okay, doctor, tell us about yourself. Tell us about what you do, your practice, and your specialty.
So I'm Benjamin Ascher, plastic surgery board back on Paris. And I'm the founder of IMCAS, which is #1 worldwide congress in our profession, dealing in Paris, Bangkok, India, China, and Latin America. And I think it's important to understand that we are the crossroad. We are the crossroad of everything concerning the innovation and development in our profession, dealing with minimally invasive surgery or economics. And I think it's important to focus on different points. Number one, during this Congress, I would like to thank Dr. Khaled Othman and the scientific committee, which seems to be on a very promising development, probably one of the lead of this content and teaching activity for Middle East. And it's important to understand that in this Congress, as many good level content, high-level content Congress, they develop very good tools dedicated to what will arise in our profession. Of course, we focus on artificial intelligence, and everything we need to be very, very strict on the control of artificial intelligence, because if we don't care, the artificial intelligence will dominate the physicians. That's the point. And the second point is that now we are on a new planet dealing with a mixed concerning the HCPS, meaning physicians and non-physicians. We are now more and more involved in our professions. And that makes some very important consequences. And number one, it's safety.
Correct.
We have a big dream of safety. The point is that now you cannot imagine what's the number of complications we are on the injections, dealing with the fact that the level of knowledge and anatomy is a little bit less. And we are about 100,000 necrosis a year dealing with this problem, and something like 50 to 80 cases of blindness. And we have deaths. So safety is one of the key points. And thanks to the fact that now, concerning our injections, we have an eyes. For the first time, you can even join, madam, that during all my career, meaning more than 40 years, I never saw exactly the vessel I'm injecting, because we have, of course, something like a blind injection. Very easy for you to understand. And the first time we have the eyes under the skin. It's skill with the ultrasound technology. Okay. And we are very happy in this meeting and in all the media. It presents the development we have now with a little miniature ultrasound on your finger. We liberate the hands and give you the possibility to have the vision of what you are injecting during the live treatment. So that's something which is going to be a revolution. It's going to modify the accuracy and the safety of our treatment.
That's extremely impressive. Okay, so let me make sure I got this right. So this new technology.
Here for you to understand.
No, I got it. I think I got it. So this new technology, because I guess before, yes, they try to place the injection and you hope that it's going to the right place. But now with this new technology, they actually are going to see where this is going to go. Like you can quickly. And did you discover this in this conference? Is this what the conference is really talking about? Oh, very good. Okay, this is very impressive. This is extremely impressive. It's really good.
Safe injection by ultrasound.
Okay, amazing. And is this already being used or is still into the testing process? Okay, so it's already out on the market?
We are going to train the doctor, but this technology, it's available.
Okay, perfect. This is very impressive. And this is something very good for the conference for sure to tell them that, most people are getting to see this. Amazing, doctor. Okay, and I love that you have so many years and experience into this field. And now that you have seen all these new technologies and things like that, tell me a little bit, how was your practice before this technology and how is your practice now? Do you have a preference of like you like having this technology available to you? You talk about safety. Do you feel like
We are augmented doctors because of the service dealing with artificial intelligence and all, the tools we can use during our consultation, pre, post, pair, and the service we provide to the patient. But anytime we need to stay on a very high level of control of all these tools, could be what I'm mentioning, and other, we need to be anytime on the human behavior. That's the point. So never forget that first we are human, we don't are robots, and we need to have a very good empathy and a very important education concerning the contact we have with our patient. That's the key. And we are never to lose this very important single message.
I agree with you 100%. I do believe in
Technology is a good point,
uh,
but behavior is a very important point as
I was just going to say, welcome the technology because obviously, like you say, it's adding to the steady procedures. Exactly. But as patients, when we connect with the doctor, it's a whole different experience. I mean, there's quite a few doctors, but when you have good communication with your doctor, and on top of everything, the doctor delivers the results, it's like, they become the people that you definitely trust and love. So, okay, so very amazing. So, you're definitely very pro into the technology. I want, if you don't mind, giving advice for these new people who coming into the dermatology aesthetics and plastic surgery. What would be an advice you give them regarding that they're just getting started into this beautiful profession?
It's a very, very interesting profession dealing with many, many innovation any times. The problem is sometimes it's only marketing.
Yeah.
Okay, it's just something to sell, and it's not really science. So the point is that for all our new practitioners, my young colleagues, they need to have a very high level of knowledge, and the knowledge it's dealing not only with the medical science for sure, we are doctors, but also now with what I meaning scientific data, dedicated to IT, dedicated to all the system to have a very good level of knowledge, not only about the dissection, about the anatomy, about all these very medical tools, but also the new planet who appear to control there. And second, stay doctors.
Okay.
And the doctors, I repeat, is not only a technician, is not only an augmented doctor thanks to the artificial intelligence, is also a people we need to communicate with the patient and give the power the patient trusts the doctor. And that's something we never replace.
Correct. 100%.
So that's the empathy. And
Yeah.
empathy is one of the key. So we need to stay people like that. But on the same times, I would like that all my colleagues begin to understand how it's the power of the plastic surgery, the dermatology, with a high level of control, and it will be very smart.
Perfect. And I wanted to ask you something because obviously, like I say, this conference is about dermatology, aesthetics, and plastic surgery. Do you see how they're important go together? Can you please explain to how
It's what of the key of our success of INCAS. I told you the number one congress in the world. It's a very single, easy understanding. Uh, Dermatology is of course one of the legs, but we need to have two legs, and it's so important that all this level of data and science be on the same goal, the same target. So we were on this sort of interesting um, association since more than 30 years, and now you know the reason.
Yes. Okay, perfect. I'm going to ask you one more thing because I love that you have, evolved with this beautiful profession and you have welcome all the technology. So you already say AI definitely helps. You also say about this new technology about the injection. Yes, yes. What other technology and your years of practice you have found this was a life-changing technology that definitely improved the how you guys are
Yeah,
able to
we are
work?
going, of course, anytime we have threats like salmon sperm, polynucleotides. So you will heard about that because it's trend, or bio-stimulation seems to be okay, very attractive for, I would say, the skin quality. Why not? So let's welcome all this
All
innovation.
these technologies.
But the point is that anytime, there is a trend and there is the control. So, for instance, AK, the injection of our hyaluronic acid staying one of the dominant point. And I am one of the guys who introduced the toxin for Euro. So I think it's important to understand that the number one blockbuster, as I say, stay the toxins. And we are on a very nice level of new toxin technology is going to appear on the market. So that's something, of course, is going to be not now, but it's a long, long history from more than some years.
Correct.
But it's stay dominant.
Yes, yes, everyone loves it right now. It's probably everyone's favorite. Okay, perfect, doctor. Is there anything in this conference that exceeded your expectations or something that, okay, you wish you would have found here? How you found this conference in general?
Over time, the conference has a very good level. The content is high, and that's exactly the target. We need to make something not only to have a nice glass of champagne or have a good fun on the beach when we are in this sort of conference, but we stay real scientists and focus on what could be now the real data. And this Congress, AIDA 225, exactly is on the target.
Amazing. Okay, I'm glad to hear that. Okay, doctor, thank you so much for sharing your knowledge.
Pleasure.
Yes, we look forward to hearing all about technology and skincare. It really seems to go together. Definitely, I love your topic and how you talk about safety. Very important. Make sure everyone is completely trained.
First say safety. And I would like the UIA authority focus on the point that thanks to what we can put on the table, they need to take decision to own the safety in our profession.
Okay, perfect. We definitely noted. Okay, doctor, thank you so much for your time. We hope you enjoy the rest of the conference and we hope to see you next year.
Pleasure.
Perfect. Thank you. Thank you.